Hey there, and welcome back. We are already on week 6 here in our Human Behavior and the Social Environment 2 class here at Widener. And in this week, we are going to be revisiting or discussing once again Danny's biography. So at this point in the semester, you have probably gained a lot more insight into Danny's diagnosis based on all of the things that we've learned. So we're also going to discuss diagnosis and the use of the DSM-5 from a critical perspective this week. So as always, the first thing that you want to do is come on over and check out the learning resources that we have here for you. So this week, what I'd like you to do is to read the week 6 reading here entitled DSM, Diagnosing for Status and Money, a Summary Critique of the DSM-5. Excellent, really compelling and interesting article. I look forward to hearing your thoughts about that. Also have some week 6 videos here, and you're asked to watch all of these videos, which offer some different perspectives on the DSM-5. So after you complete the reading and watching all of the videos, you want to do your one discussion board post this week, which involves assessing Danny's biographical timeline once again. So here's the link right here. You can go back and check out Danny's biographical timeline, as well as Dr. Barrel's biographical timeline article and Professor Ginny Folk news video. So I highly recommend that you really go back and utilize, revisit all of these resources with some fresh eyes and a real beginner's mind. Also keeping in mind all of the information that you've gained since then, since you've watched those things or read them for the first time. So the first thing that I'd like you to do is to make suggestions for how to go about assessing Danny. So think about what supports are needed and what do you think you should ask Danny directly to obtain the most information possible. Number 2, based on Danny's timeline, do you think he has behavioral manifestations, signs, symptoms of a mental health condition? If so, use the DSM-5 diagnostic language to substantiate his DSM-5 symptoms and your diagnosis. So number 3, people can have a long list of diagnoses assigned over time. Not all of the diagnoses are based on a holistic assessment using a diagnostic framework. So choosing the 1 or 2 diagnoses that you think best explains Danny's symptoms. Does your diagnosis agree with Danny's list of previous diagnoses? Why or why not? So I'd really like to see you show that diagnostic language that you've learned to substantiate your answer. So this discussion board prompt requires that you follow up with at least one classmate, and you remember that your initial post is due on Thursday and your follow-up responses are due in between Friday and Sunday. So once again, it's a busy week here in 502. You're remembering that your submission is due for your condition presentation, as well as your clinical vignette part 2 is due this week as well. So you want to make sure that you're submitting those in the proper assignment folders. So I hope that you have a peaceful and productive week, and I look forward to reading your work.